Thank you, Mr. Chair, and
Mrs. Stevens.
thank you so much. And I am sitting next to another Lakes member of the Congress from Minnesota here. So, but we pride ourselves on our fresh water. Look, it's wonderful to have your expertise here. And there's some PhDs in economics, and we had a vote last night, kind of in the dark of the night. First we were voting, then they said no vote on this budget resolution. Everyone left the Capitol. Then out of nowhere they said, we're actually just kidding, we're gonna vote. I mean, it was wild. Some of these reporters saying, covering the Congress for decades, they'd never seen anything like it. Now, the $880 billion cut to Medicaid is compelling me here regarding this topic of an exercised workforce. Because as an evangelizer of special education programs, fully funding the realized promise of IDEA and special education in the United States of America, I also think about the families in Oakland County, Michigan, who have children with medically complex conditions and scenarios. And I've heard this all over. They would be bankrupt. They'd be sold out the river without Medicaid. And so, Dr. Shearholz, maybe you could start here, because I'm just trying to think, when we have the lowest levels of unemployment, otherwise known as the highest levels of jobs in Detroit, Michigan, manufacturing town, in over 50 years. That happened 2 years ago. I told the president about it. I thought, this is exciting. This is a moment for us. But what does this mean if we're going to really make all these cuts to Medicaid? And what does that do to our workforce?
It's really, really bad for our workforce and for our most vulnerable families. And the other thing about Medicaid, in addition to the things that you were mentioning, is cutting Medicaid will have negative impacts, not just now, but literally for generations. There is very solid research that shows kids getting Medicaid as a kid, they have better outcomes, better income, better health, better educational attainment as grown-ups. So when you think about the idea that policy that is so unbelievably effective in helping our most vulnerable houses, the idea that households, the idea that is on the chopping block is just
and these are working professionals, and we want these people. I mean, sometimes they get home health for that dependent, and I'm just thinking to the hotel and lodging, you're in this big race for, workers. But I'm just thinking, wouldn't that help you get more workers if people were, had their Medicaid?
Thank you, Congresswoman, for that question. Look, I can tell you that we offer competitive wages and expanded benefits, and at the same time, we are still 200,000 people down. So there are certainly a lot more pressures that exist in terms of attracting people into our industry.
Yeah, it's a shortage, and I just think about, look, I'm in my communities, and I think about these people, they want to go to work, and they got dependents, and they need the schools with the programs, and they need the access to health. And, Doc, you're also an economist. I mean, haven't you read about this, that we need health care for the most vulnerable so that they can get to work? I mean, we got 200,000 open jobs. What's the impediment? Is it a workforce protection, or is it actually basic services that enable people to go and work?
Healthcare is absolutely essential for workers. That's true. And we're talking about Medicaid right now and cuts to Medicaid. I would encourage everyone on this committee to think about the billions of dollars in Medicaid missed payments that have been documented. The misallocation of funds to people who are not executing the program. And there's a lot we can do before we go into the Medicaid program where it affects individuals and their recipients of it.
Maybe I'll have a round table with some of these people who've been abusing Medicaid. I just have never met them. The only people I meet are the people who are working their tails off, trying to make ends meet. I don't know if you've ever walked into a union household, because I have.
Yeah,
and this is not a shout back at you. I'm just saying, I meet these families, and they're incredible, and they want their kids to exercise their full potential. And you're right. I'll be honest, we do have to have a cleanup of waste, fraud, and abuse, but not at the expense of punishing a workforce when we got job openings and needs. These are our taxpayer dollars,
And we're paying into a government as Americans that is owed to us, not gajillionaires who in the dark of the night are proposing things and not responsible conversation. And so I thank my chair for enabling me to use my 5 minutes as a lawmaker to start this conversation. I look forward to continuing to have it, and I yield back.
I thank the gentlelady, and I recognize the gentleman from Guam, Mr. Moylan.